Pet Advice, sponsored by University Veterinary Care Center.
This morning, we welcome Dr. Travis Gratton with University Veterinary Care Center for this week's Pet Advice segment. Good morning, Dr. Gratton.
Good morning.
We all know that it's important to get our pets spayed and neutered, but it seems like a surgery so basic can vary in cost from place to place across the city. So let's talk about that just a little bit.
Sure.
What are some of those variables that are affecting cost?
Yeah, certainly, if you get one of those cute, adorable ones that we showed at Helping Hands there a minute ago, our colleague and friend Dr. Grace and her staff have taken care of all that spay and neuter, but otherwise it's one of the more common things that people will search out in the veterinary market for. You say it's a routine surgery, and in some senses it is, but any surgery certainly can get a little complicated. And so, there's kind of the big areas where cost varies a lot from practice to practice based on their philosophy. You've got kind of the list on the screen, the pre-anesthetic, how the anesthetic is administered, the expenses associated with monitoring, and then all the post-operative care involved. It's kind of varies a lot on staff involvement and how many people, and of course people cost money and take time, and equipment and technology certainly runs those costs up quite a little bit. So,
well, and each of those variables have multiple factors that, as you mentioned, affect price. So let's dig into those just a little bit more.
Sure. Starting
with the pre-anesthetic screening.
Yeah, fairly commonly, most practices will at least offer, and a lot will require, blood work being done. Every animal certainly is going to get a thorough physical exam and hopefully some review of the history of the animal, kind of putting all the pieces of that together with the medical record and that. But the blood work for how organs are functioning, and is there surprises to be found, things to minimize risk when they are anesthetized, or complications with surgery. So.
And anything with the protocols for anesthetic protocols?
The anesthetic protocols are probably one of the biggest factors, actually. A lot of lower cost facilities will use injectable anesthetics. It's just a calculated dose of some combination of drugs. It's injected usually into the muscle, and it's generally safe. There's not big problems, but you can always give more, but you can't really take it away. When you start getting into the gas anesthetics, then you've got an anesthetic machine, the vaporizer. You're intubating the animal to protect the airway and be able to monitor breathing and oxygen saturation and those kinds of things. So again, technology and people involved in that process are going to make a difference.
Well, and I'm sure we're almost out of time, but I'm sure the post-operative care too, there could be some variance with that as well.
Yeah, the danger times are when we're going down into anesthetic. Usually maintenance is pretty smooth sailing a lot of times. Certainly if blood pressure is being monitored and everything is doing okay, we're fine. But waking up is the other part. Again, kind of heavy tech involvement, and licensed techs are going to add some time on that. But if we're checking on animals every 15-20 minutes until they're fully recovered and checking vital signs and that, it's going to be more time and more expense. So a lot of variation out there, and we often get questions from people who,
sure.
Why is there such a variation? And like I said, it's not one factor. There is cost to everything, and it's kind of that balance that each individual practice finds.
Well, this is some good insight for us. Dr. Gratton, thank you so much for being with us today. And if you'd like more information about University Veterinary Care Center, just head over to universityvetcare.com.